So today we will be briefly talking about hemorrhoids. What are hemorrhoids? Their function and types, and then we will be talking about what options do we have when these hemorrhoids become symptomatic and causes symptoms to the patient. So hemorrhoids are normal part of anatomy of the anorectum. They are basically vascular cushions and they serves to protect the anal sphincter, help in closure of the anal canal during increased abdominal pressure, and they also provide sensory information to help differentiate between liquid, gas, and solid. So there are two types of hemorrhoids. One are the internal hemorrhoids and the other are the external hemorrhoids. Basically, the normal anus of an adult is about 4 centimeter, and there is a line that is called dentate line, which is roughly at midpoint of this anal canal. So hemorrhoids above the dentate line would be called internal hemorrhoids, and those below the dentate line are called external hemorrhoids. So the internal hemorrhoids are covered by columnar epithelium and they are supplied by visceral innervation, and that's why they are most of the time they are not painful when they become symptomatic or enlarged, while the external hemorrhoids are covered by squamous epithelium and they are supplied by cutaneous innervation and are very painful when they become enlarged and become symptomatic. So these were the types of hemorrhoids. So every human does have these vascular cushion, but normally we do not call it hemorrhoids. When do we call it hemorrhoids? When these vascular cushion become enlarged, engorged, and causes symptoms to the patient, then we call these as hemorrhoids. So when and they are external hemorrhoids and they become symptomatic, then they are surgically excised, while internal hemorrhoids and they are further divided into four grades, and depends on which grade the hemorrhoids are, then we treat different grades and differently. In grade 1, these hemorrhoids uh, causes only rectal bleeding. There is no prolapse, there is nothing coming out of the anal canal or during defecation, but there is just bleeding per rectum. And in grade 2, these hemorrhoids prolapse, but they do reduce spontaneously itself. While in grade 3, there is prolapse of these hemorrhoids, and they do not reduce itself, but they needs to be reduced manually. While in grade 4, these hemorrhoids are permanently prolapsed and they are irreducible. So now we will be talking about the different treatment options, and it depends on the grade of hemorrhoids. If a patient have grade 1 hemorrhoid, it is most of the time treated medically by advising stool softeners and counseling the patient to take a fibrous diet like vegetables, fruits, and water intake should be encouraged, and advise the patient to take sits baths. So sits baths are basically taking lukewarm water in a water tub and sitting in it for quite some time of a day. So and along with that, topical analgesic and nitroglycerin based ointments can be advised. So most of the time with these medical treatment, the patient complaint relieves in grade 1 internal hemorrhoids, while in grade 2 internal hemorrhoids, along with this medical management, any of the following minimal invasive technique can be applied, like rubber band ligation, cryotherapy, infrared coagulation, and sclerotherapy. So grade 2 internal hemorrhoids, is treated with this management line. While in advanced grades of internal hemorrhoids like grade 3 and grade 4, there are then invasive methods of treatment like open hemorrhoidectomy, stapler hemorrhoidectomy, Milligan Morgan hemorrhoidectomy, and Ferguson hemorrhoidectomy. So these are basically advanced techniques and used for advanced grades of internal hemorrhoids. Thank you.